Next, we're going to hear from Med Center Bowling Green. The team at Med Center Health in Bowling Green has been on the front lines since day one. They show up daily, and they've even suffered a loss of 2 of their own. Dr. Rebecca Shadowin, an infectious disease expert, Dr. Don Miller, an ER doctor of 17 years, both paid the ultimate sacrifice while caring for and treating patients with COVID-19. If I remember right, they may have lost another individual as well. The virus is deadly, yet our brave healthcare heroes continue to show up even after they have lost their colleagues to protect us. Now, they need us to step up for them. Today, Dr. William Moss, Director of Med Center Health Emergency Department, and Katrina Wood, Chief Nursing Officer, are sharing their message on where hospitals currently stand on capacity and what it will take for us to turn this surge around.
The medical center at Bowling Green is at capacity. The critical care units are full. We are unable to accept patients from outlying facilities that we normally take and that need our help, and we want to be able to help them. Our emergency departments have patients holding for critical care almost every day. The way the community can help us to be able to take care of you is to get vaccinated.
And one of the things I wanted to stress to our community is that you're doing this not just for yourself. This is a community. We all live here together. This is a population of Kentuckians, your neighbors. We're all trying to do this together. And when we're crowding a hospital with COVID cases, that's somebody's neighbor whose arm is broke who'll have to wait longer. That's somebody whose neighbor is going to have a heart attack and possibly have a delay. That's somebody who's going to have a stroke, and because EMS is full of runs, they're not going to get to the hospital as quickly as they can. We're really doing this not for ourselves, but for our community. I don't feel it's proper to bully people. I don't feel it's proper to make someone feel guilty because they're not getting it. I just want them to realize that this is something we're doing for each other. It's not an individual thing. It's a community thing. So I really encourage everyone to please consider getting the vaccination. And if you have questions, ask about it with your doctor. And don't be hesitant to even call or ask me if you know me. I'll be happy to answer any questions for you. But it's a process that we need to consider others as we consider ourselves. It's very important. So I urge everyone to get the vaccination.
You can see and hear the exhaustion from these incredible folks. That's something I want to talk about in a minute because it's something we ought to be able to help with. So for months, Dr. Stack and I have been telling anyone who will listen to get vaccinated. But you don't have to take our word for it. Listen to nurses, doctors, and hospital leaders on the front lines that are encouraging vaccinations while they are taking care of your neighbors in your community every day. So our last video is from members of the Baptist Health Hardin in Elizabethtown team. It's Dr. John Godfrey, Vice President and Chief Medical Officer, Sharon Wright, who's the Vice President and Chief Nursing Officer, and Dennis Johnson, President and CEO of the hospital system. As of this morning, Baptist Health Hardin has 91 patients battling COVID. For comparison, during the surge in December, the highest day they had was 56. That's almost double the worst that we saw before. And out of the 20 ICU or critical care unit beds of Baptist Health Hardin, 18 are currently filled by COVID patients. That's 18 out of 20. And almost all of them are unvaccinated. With the Delta variant surging, COVID-19 is causing extraordinary hardship on these nurses, these doctors, and these hospitals, unmatched at any other time in this hospital's history. To this team, my goodness, thank you. And all of you, thank you. We're going to talk about that again in a little bit. But for all of you, we should all get vaccinated.
Here at Baptist Health Hardin, we're feeling the strain of the most recent surge of COVID-19.
We're seeing a significant increase in the number of COVID patients, both in the hospital and in our outpatient clinics. These patients are occupying over a third of our hospital beds. In fact, we're using high flow oxygen and ventilators at rates that we've really never seen before in this hospital. We sincerely want our community to be back to normal, to be engaged in normal social activities. But to do this, we really need everyone's help. What's going on with COVID right now in the community is significantly straining our healthcare system.
We are no different than any other facility in the state of Kentucky. We are facing staffing challenges amidst rising patient volumes. Many of our staff are quarantined from COVID exposure. Some have retired, some have resigned and left healthcare entirely.
We've seen higher volumes than we've ever seen since the beginning of this pandemic. But this is what's different this time around. We now have a vaccine. We know that while this vaccine is not perfect, it does 4 things, and we've witnessed these 4 things right here at our hospital. We know that this vaccine reduces severity of illness, reduces hospitalizations, reduces ICU admissions, but most importantly, reduces deaths. So we're asking, in fact, we're pleading with every Kentuckian, please get vaccinated. Wear a mask, practice good hand hygiene, practice social distancing. Together, we can wipe out this pandemic.
So as of today, we believe we have at least 21 hospitals across Kentucky with critical staffing shortages. We are continuing to work and hope to have next week a metric on beds, staffed beds versus just beds that have been approved in past filings to show how quickly they are filling up, and in regions where there are no beds left. We have identified, and Department of Public Health is able to identify a number of hospital challenges in addition to just being full. Inability to transfer patients due to lack of available beds in other places, including pediatric cases. We have hospitals that don't have pediatric ICU units that are now having to work to try to create them, to try to create the ability to do that. Crisis standards of care. That's something you probably never want to hear in a hospital, that they have to implement, how they're going to triage, what they're going to do, how much staff per bed there is, because when you got this many patients and we're having the staffing issues that we have, all of a sudden there's not one for every X. There's one for every Y, meaning fewer people taking care of more patients. Cancellation of elective and non-emergency procedures. Look, this is how hospital systems make money. And they need to make money, stay open, to expand, to do things. If they are canceling this, it shows that it's that bad. And I'll tell you, our hospital systems have been incredible. That when we reach this stage, they're willing to do this, even though it hits badly at their bottom line, because their calling is to make sure they can take care of as many sick people as possible. Staffing shortages, emergency medical staffing shortages, EMS struggling with 911 runs, and then more people coming into the ER just to get tested. Folks, there are other places to get tested. With the ERs being overrun as they are right now, please find a different testing location. Don't go to that emergency room. There are too many people that are already at that emergency room with significant needs.